What is a high blood pressure? How to treat it? High blood pressure is a common condition in which the long-term force of the blood against your artery walls is high enough that it may eventually cause health problems, such as heart disease. High blood pressure is very common. It occurs in 25% of adults. It can lead to heart attacks, strokes, and kidney failure. We don't want that. High blood pressure is easy to diagnose, and it is easy to treat as well. First, all you need is to have somebody check your blood pressure using an apparatus. Some device that will check the blood pressure is called sphygmomanometer. There are also other types of blood pressure apparatus like the digital, portable automated unit, and they are fairly accurate. How do you know if you have high blood pressure or not? If your blood pressure is 120/80 or a bit lower, that means it is normal. But if your blood pressure is 120/139, which is the first number, called systolic, and the second number, which is the diastolic, is 80/89, that means it is a little high, that we need to monitor it. If your number 140/159 systolic, and 90/99 diastolic, that means that it is quite high. You may need to change your lifestyle, and maybe take medicines later on. And if your blood pressure is over 160/100, then that means that you need to see your doctor soon. Now, let's talk about lifestyle changes. There are 4 effective lifestyle changes to reduce your blood pressure. Number 1. You need to lower your salt intake. Eat less salty food. Exert an extra effort to lower your salt intake. By doing this, it can reduce your blood pressure maybe by 5 to 10 points. Number 2. You need to lose weight if you are overweight. If you can lose around 10 excess pounds, this can lower your blood pressure around 5 to 10 points. Number 3. You have to exercise. Walk more. You can do this even at home, if you are not ready to do it outside. Number 4. Try to eat less meat and more fruits and vegetables. And now, let's talk about the medicines for high blood pressure. There are 4 common medicines that doctors give for high blood pressure. It begins with the letters A, B, C, and D. Letter A stands for ACE inhibitors. ACE inhibitors like captopril is a generic drug. It is good for patients who are diabetic or those with heart failure. And also, only 5% of patients may get cough after taking this medicine. So, if you get cough, ask your doctor to shift it to another drug. Next is letter B. B stands for beta blockers. Beta blockers like metoprolol is good for patients with angina, palpitation, or patients with heart disease. So, this is quite a good drug. Next is letter C. C stands for calcium antagonist. Calcium antagonist like amlodipine is a very powerful drug. It is good for patients with high blood pressure. But, in a few patients, they may have leg swelling or edema. And the last one is letter D. D stands for diuretics. Diuretics like hydrochlorothiazide. This will be given mostly to the elderly patients. It is diuretic medication, often used to treat high blood pressure and swelling due to fluid buildup. Other uses include diabetes insipidus, renal tubular acidosis, and to decrease the risk of kidney stones in those with a high calcium level in the urine. In summary, you can treat your high blood pressure with natural lifestyle changes. And later on, your doctor may give you the 4 medicines that were mentioned. And don't worry, because these medicines are very effective. As a final advice, take care of yourself. Watch your diet, and have some few minutes of regular exercise. I hope this little tips will help you improve yourself, or someone's health, a bit longer. Thank you for watching. Please don't forget to subscribe.